this is Andrea Ross. It's November 3rd, 2019, and today we're going to be talking about the skeletal system. First, I do have one page of notes, front and back. I might be referring to that a little bit later in this video. First, we're going to be talking about the main components of the skeletal system, which include the skeleton, cartilages, ligaments, and other connective tissue that either interconnect or stabilize the bones. Bones are classified according to shape, so we're going to go through a few shapes and some examples of where you might find them in the body. First, sutural bones are small, flat, oddly shaped bones found between the flat bones of the skull along their sutures. Next, pneumatized bones are bones that are hollow or contain numerous air pockets, such as the ethmoid bone in the skull. Short bones are box-like in appearance, and they're found in either the carpal bones of the wrist or the tarsal bones of the ankle. Irregular bones are very complex shapes with short, flat, notched, or ridged surfaces, and they are found in either the vertebral column or some bones in the skull. Flat bones are thin, roughly parallel surfaces that contain compact bone on the outside and spongy bone on the inside. They make up the roof of the skull, your sternum, your ribs, and your scapula, or your shoulder blades. Next, we have our long bones, which are relatively long and slender. They make up lots of our appendages, like our humerus of our arm, radius, ulna, our femur, and we'll talk about some other appendages once we go through our bones in the skeletal system. The last shape we're going to talk about is called sesamoid bones, which are small, round, and flat, and they usually form deep inside tendons, usually around the joints of the knees, hands, or feet. Not everyone has a sesamoid bone in every possible location, but everyone has a patella, which is your kneecap, and that is actually a sesamoid bone. So now we're going to go through the whole entire skeletal system, naming all the bones in the body, and I'm going to go through based on division. So the first division is the axial division, and that includes the skull, the vertebral column, and your thoracic cage. So starting with the skull, we have the cranium, and the front bone on top is the frontal bone. Then on the two sides, we have the right and left parietal bones. Further down on the side, we have the two temporal bones. Over on the back, we have the occipital bone, and you can actually see the ethmoid bone through the eye sockets. And the sphenoid bone is kind of my favorite bone of the skull. It's this really funky shape that acts as a cross brace throughout the whole entire skull, really stabilizes everything and makes the whole structure a lot stronger. Now we're going to go into the facial bones. So I want to start with the nasal bones. Those form the bridge of our nose. Right inside, laterally to them, are our lacrimal bones. Those house our lacrimal ducts, which are our tear ducts. What forms the bony part of our nasal septum is the vomer, which you can see right here. And then deep inside that, I can't really show, is the inferior nasal conchae. There's two of those, and they are shell-like bones on the inside of our nasal cavity. Right in front here, you see our two maxillae. They form the vast majority of our face. Right inside here, if I can open his skull or his jaw, we have two palatine bones that make up the roof of our mouth. The jawbone that I was just moving is called the mandible. Up here next to our maxillae, we have our two zygomatic bones. Those form our cheekbones. I'm going to take a quick look, make sure that I got them all. All right. Next, we have our associated bones of the skull. These aren't actually included in the skull, but they're in the general vicinity. So on each of the sides of our head, we have our auditory ossicles, which are the bones of our inner ear. On each side, we have a malleus, an incus, and a stapes. So there's two of each of those. Then on our throat, we have a hyoid bone, which doesn't actually articulate with any other bones of the body. Instead, it's suspended by some connective tissue and ligaments. Up next in the axial division is going to be our vertebral column. So the first section we have is called the cervical section. So each of our vertebrae are named based on the first letter of their section. So in this example, it would be C. And then we have a subscript number. naming which number vertebrae they are in the section. So our cervical section is a little bit unique because the first vertebra is called the atlas, the second vertebra is called the axis, and then you have C2 through 7. Up next we have our thoracic vertebrae, and these all articulate with at least one pair of ribs. So we have 12 thoracic vertebrae, so it would be T1 through T12. Up next we have our 5 lumbar vertebrae, so that would be L1 through 5. And lastly we have our sacrum and our coccyx. The sacrum is 5 bones fused together, and our coccyx is 3 to 5 bones fused together. The coccyx is also known as the tailbone. The last section of the axial division is going to be our thoracic cage, also known as our rib cage. So we have 12 pairs of ribs. 7 of these pairs, numbers 1 through 7, are called true ribs because they articulate directly with the sternum via costal cartilages. A sternum is a flat bone in the middle of our chest that connects those ribs. Ribs 8 through 12 are called false ribs because they do not articulate directly with the sternum. However, ribs 8 through 10 do articulate via joining with the costal cartilages of rib number 7, so they do end up joining with the sternum. Only ribs numbers 11 and 12 do not articulate with the sternum at all, so those are referred to as floating ribs. And that's the last section of our axial division, so now we're going to move on to the appendicular division, and that includes our shoulders and our hips and all of our appendages. So first I'm going to start with our shoulders. That's also known as the pectoral girdle, because this connects our upper appendages to our axial skeleton. So first we have these 2 S-shaped bones called clavicles, and on the back we have 2 flat triangular bones called the scapulae. And now I'm just going to go down just one side, but each of these bones has doubles on the other side. The upper bone of our arm is called the humerus. Directly below we have the ulna and the radius lateral to the ulna. Then in the wrist we have 2 rows of short bones. The first row is called the proximal carpals, and this starts on the lateral side with the scaphoid, lunate, triquetrum, and the pisiform. Then the distal carpals, again starting laterally, are going to be the trapezium, trapezoid, capitate, and hamate bones. Next we have the metacarpals, which make up the bones in the palm of our hand. We identify these based on Roman numerals starting from the pollex, which is our thumb. So that will be metacarpal 1, 2, 3, 4, and 5. Lastly are our finger bones, which are called phalanges. Now in our thumb, we have only 2 phalanges, proximal and distal. In our other 4 fingers, we have 3 phalanges in each finger, proximal, middle, and distal. Now we're going to move on to the pelvic girdle and our lower appendages. The pelvic girdle is made up of our hip bones, our sacrum, and our coccyx. Now, though the sacrum and the coccyx are part of the axial division, they do help to contain and protect all of the organs in the pelvic cavity. The hip bones are made of 3 bones fused together. First is these ilium, then you have the pubis bones and the ischium bones down here. Now our lower appendages. Our thigh bone is called the femur, then we have a patella, kneecap. We have our tibia and our fibula lateral to the tibia. Then we have our tarsal bones of the ankles. The calcaneus bone is the largest bone, that's our heel bone, so that can hold most of our weight most of the time. Then we have our talus bone, navicular, our medial, intermediate, and lateral cuneiform bones, and the cuboid bone. Our foot bones, very similar to the hand bones, these are called metatarsals. Again, they're named by Roman numeral 1 through 5, starting at the hallux, which is our great toe. So metatarsal 1, 2, 3, 4, and 5. Then our toe bones are called our phalanges. The great toe has only two phalanges, distal and proximal, or proximal and distal. Then our other four toes have proximal, middle, and distal, just like our fingers. And that's all the sections of the bone. So we just went through them all. So now a good example of a clinical application that I could use all of this knowledge would be if I were acting as a physician assistant in either an ER or an urgent care center. Someone could very likely come in with a bone fracture. So the book talks about lots of different common bone fractures, and the one that I want to talk about is called a Colles fracture. And that is a fracture usually in the distal portion of the radius, and it usually results after trying to cushion a fall by putting your hand out. So for example, if a child were to come into my clinic complaining of lateral arm pain in their radius, and maybe they tell me that they're learning how to skateboard and they had suffered a fall earlier in the day, I would suspect that this would be a Colles fracture. Now, if this was not an open fracture, meaning that it would be closed, the skin would be intact, there's no way to know if it's an actual fracture until you get an x-ray so that you can visualize the bone. If this were an open fracture, that means that the bone actually breaks through the skin, so it's obvious clinically that the bone has been broken. There's lots of other kinds of fractures that I could easily use in my career if someone were to come in with a different type of fracture. But this would be very useful in urgent care and emergency type settings. So that's it for my summary. Thank you for watching.